Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective. Welcome to Behavioral Health Today. I'm your host, Peter Fenger, and joining me today is my co-host, Sharlee Dixon. Hi, Sharlee.
Hi, Peter. How are you?
I'm doing well. Well, I'm excited for our show because this is another episode of BHT Bytes, where we break down mental health and societal trends into quick, digestible conversations. Well, today we're talking about peer recovery specialists, a vital but often overlooked part of the recovery landscape. These are people who've lived through substance use challenges or supported loved ones through it, and now use that experience to help others navigate their own journey. Now, it's not limited to just substance use challenges. I can sort of expand on it as just those who have gone through that experience. But peer specialists don't replace doctors or therapists. Instead, they kind of bring something unique, a shared understanding, mentorship, and hope. With nearly 49 million Americans reporting substance use disorders and over 100,000 overdose deaths in 2022, their work is more critical than ever. From hospitals to community centers, courts to recovery houses, peer specialists bridge gaps in care, helping individuals stay engaged in recovery, build community, and regain a sense of purpose. But despite their proven impact, programs are facing threats from budget cuts, low wages, and inconsistent training, raises urgent questions about the future of this essential workforce. So today I wanted to take a moment to explore why peer recovery specialists matter, how they operate, and what's at stake if these programs are weakened. So Sharlee, I sort of wanted to start by just defining what the heck the role is.
Okay.
So a certified peer specialist, or a CPS, is someone who has personal life experience with mental health condition and is further along in their treatment journey. They've been trained to use their personal experience to help others cope with similar health conditions, and they know what they're going through because they've been through it themselves. Their duties will often include knowing more about your situation, identifying areas you need help with, as well as identifying areas of strength where you've overcome difficult situations. They can provide emotional support, feedback, and help problem solve to help you make good decisions and reach your goals toward recovery. So I want to ask you, Sharlee, from your experience, what makes the role of peer recovery specialist unique compared to maybe traditional clinical providers, and why lived experience is such a powerful tool in recovery work?
So as we mentioned kind of before, I don't necessarily have the working experience with peer recovery specialists as far as, substance abuse disorders. However, I know the power of peer support in general. Working in my current field in dialysis, as well as, even in the school system, as a social worker, we've always relied on those who have that lived experience to come back and try to help those who are in those same situations. For example, I currently work, in dialysis, and I work with a lot of patients who are doing their own dialysis at home. So as someone that does not have a kidney issue, I can only vaguely speak to, the emotional and mental health issues that may come along with not just having a lifelong chronic illness, but also with kind of being in charge of your own healthcare at home, which is scary.
Right.
Not just to anybody, it's scary to me, it's scary to the people that are doing it. And so we use patients who are still doing their own dialysis at home, but they come back and speak to new patients in the clinic to just, offer their support, offer their experience. And so I really think that lived experience, that being able to say, I've been there, literally to say, I've been in your shoes, in your seat, in this process that you've experienced, and this is how I made it through. You can make it through. Not only can you do it, but this is how it can be done. And I think it is a powerful tool to be used to show, in all walks of health, mental health, to say that we understand you, we've been where you are, you can make it. And that, I think, is where that power comes through with that role of having a peer, whether it's a peer support or peer recovery, just that peer support level is there to offer that lived experience.
Yeah. I sort of remember some things that Graham used to say. He says, it takes one to know one. And I think that
Absolutely.
that's exactly the piece that peer specialists really fill, is that place of knowing,
Mhm.
and we've seen popularities of peer specialists kind of come up with a number of guests that have come onto our show. I think
Yes.
of City Block.
Yes.
And I'm thinking of George Petit and Zero Overdose, and on and
Absolutely.
on and on.
Hmm.
We've had a number of guests that have come on and really talked about the power of how peer specialists can really be sort of that special sauce in reaching people and getting them into recovery and through it. And, some of the things you're talking about, sharing those stories, it really gives people a sense of how people can sort of overcome and control their symptoms and how it can be possible, right, by sharing those stories. Peer specialists can also help and identify coping skills that can help
Absolutely.
create recovery plans, as we've seen,
Mhm.
and it also providing support and challenges in other areas of their life. I also think
Absolutely.
it's important for folks to be able to get engaged, maybe with recovery systems from an area that's maybe not clinical, right?
Mhm.
We can talk about vulnerable populations that may have had bad experiences within healthcare, within
Mhm.
criminal justice. You're talking about people who are sort of kind of outside that area, and that can sort
Absolutely.
of be the branch that reduces stigma. Again, I talked about how these are folks that are engaging in gaps of systems, talking about the healthcare system, the justice system, social security systems.
Mhm.
All those systems can be kind of difficult to navigate.
That
And
can be,
so
yeah.
having somebody kind of step you through and walking you through some of that can be really the difference of you engaging and participating and following through with that. The other thing I
Absolutely.
think is interesting is that it's also a system based on mutual benefit, right?
Mm.
Because providing support strengthens the peer support workers' own recovery,
Yes.
right?
Absolutely, it definitely does. And I want to echo everything that you actually just said, because being able to, when you are, no matter what the area of need is, whether it's a health concern, whether it's a mental health concern, substance abuse, no matter what it is, hearing from somebody that has been there to say, hey, this is what I did. Hey, do you know about these programs? Hey, do you know about how you can help get this paid for? Or has anybody talked to you about this system, this program that you need help with? Have you talked to this particular person at the Social Security office or whatever it may be?
Right.
Just somebody to kind of hold your hand through the process. It can be as quite a scary one, and many times for people, they don't necessarily come into recovery systems for anything with having a positive experience
Right.
in their past with different systems there. So I think it's important to have that gentle handoff to
Yes.
what's needed.
Yeah, absolutely. Absolutely. And again, just to, talk about the scale of this crisis, I mentioned that 49 million US individuals have reported substance use disorder in 2022. In that time, we've had 107,941 overdose fatalities. And it seems to be increasing across the continuum of substance use disorder care. So I want to ask you, with so many Americans reporting substance use disorder and overdose deaths still at record high, where do you
Mhm.
see peer recovery support making the most difference in closing some of that treatment gap?
I think a lot of that, again, lived experience for one, but then also while doctors and nurses and even social workers, we come with this huge wealth of knowledge and the want and need to assist people. Sometimes people don't always view or perceive that help as something that is very helpful. And
Hmm.
so I think when you have someone that has walked in the shoes before, has been through these things before, I think that it gives a different non-clinical approach to, we may be saying the same exact thing, but it is going to come across differently from someone who has lived there, who has been there, who has done the things.
Right.
And so I think they can get into some places that clinicians may not necessarily be able to get into or to break into
Right.
just because of that clinical role. Peer support specialists may also, or peer recovery specialists may also be able to say some things that clinicians may not be able to say in a
Yes.
way that is relatable
Hmm.
to clients, to patients. And so being able to
Right.
hear familiar wording from people also changes your perception and your brain's availability or ability to accept the information that is given to you. Just that terminology that may be used, even if I said it, it might not come across correctly. You may not understand it directly from, this social worker lady in a white coat. Like, that doesn't make sense. Like, the words that you're saying don't make sense. But
Right.
from someone that can say, hey, I've been there. I know
Mhm.
what this feels like, and really know what it feels like, and not just, being able to empathize.
Yeah, yeah, absolutely. I mean, you're talking really about the relationship, right? It's
Absolutely.
relational work. And when we
Absolutely.
start to meet people where they're at, we can one not only give the help that's needed. Again, I'm talking about maybe the gaps or meeting folks within the gaps of
Mhm.
our societal systems. Again, that can look like community based. It's meeting folks in recovery houses. It's meeting folks in community centers, faith organizations. It's doing work within the healthcare system,
Mhm.
hospitals, emergency rooms, outpatient clinics. It's doing work within justice systems. So talking about drug courts, prisons, jails, reentry programs. These are folks that are really trying to engage with this population, vulnerable populations, in some of those gap areas. And what you're talking about is the relational work, but I also think it's part of the delivery, right? It's unique
Mhm.
how peer specialists are able to meet. You're talking a little bit about one-on-one, right? Being able to engage with
Right.
folks within the community, but also it can look like, group facilitation, right? Support
Right.
groups. It can
Mhm.
also look like individual services. You talking about coaches. It can also look like
Right.
workshops that are
Mhm.
delivered. So I'm starting to think of, how peer specialists might engage within maybe a public health approach,
Mhm.
right?
Mhm.
Trying to engage folks within the community. Can also look like, we just talked about it, engaging with different clinical services, right? Being able to sort of bridge that gap between
Yep.
different services and
Right.
also advocacy, right? Being able to give vulnerable populations a voice, maybe even working with politicians in order to address policies. And also, I think all of this really kind of helps the community and understanding where services are offered, and all that sort of reduces the stigma of mental health support.
Absolutely. Absolutely. Yeah. Because oftentimes someone in recovery from any, type of illness issue, they may not look like on the outside that they are struggling.
Mhm.
And so to be able to say, oh, wait a minute, like you don't look like you have any issue. You've had an issue with this.
Right.
Like, wow, like it gives again, it reduces that stigma to say, like, oh, I can go get help too. And then
Normalize.
outright, it normalizes those feelings of, maybe there is some feelings of failure there, shame. And so I
Right.
think that is also reduced in being able to see someone that may look like you or may not look like you and say, you know what? Okay, so if you can make it out, so can I. Like this is
Right.
doable for me to do.
Yeah.
So yeah, it definitely reduces stigma as well.
Yeah, absolutely. And it delivers hope.
Definitely.
It delivers hope. So the
Absolutely.
next thing I want to talk about is just what does the training look like? So for somebody that might be interested in going into a certified peer specialist role, it usually looks about 40 hours or so of formal training that usually covers ethics or communication and boundaries. Some specialization certification would require advanced training. Mental health. It could also look like trauma and informed care. It could also look like crisis intervention. And then often that certification is met with continuing education,
Mhm.
so ongoing professional support. And then oftentimes, there is a requirement of having either a high school degree or maybe even a bachelor's degree, and that really varies state by state. So just talking a little bit about the training of peer specialists, how do you think the balance between accessibility, because we saw this with COVID, right? There was a huge
Yep.
influx of folks needing mental health support. So
Right.
how do you think of the balance between accessibility and the professional rigor that should be handled so the workforce can both grow and maintain quality?
Got you. That is kind of a tough one. Because I
Yes.
do agree that during COVID, we did have to make certain concessions, and there were all across the board in mental health fields and even in education, teachers were not. You didn't have to necessarily have certifications, to be able to teach. But at the same time, you have to be mindful about training and making sure that folks are receiving specialized training that matches the population that they serve. I do
Right.
think that there has to be a certain level of, you mentioned trauma informed care and crisis intervention. I think in any field that we're discussing here, I think those need to be the basis of it. But I do agree that with so many different budget cuts and less accessibility, that there is going to have to be some shift to the level of training that is required
Right.
educationally, especially if we're speaking about having to have a bachelor's degree.
Right.
Some folks that are in recovery may not necessarily even have that bachelor's degree, so you're cutting out a huge group of people that could potentially provide that support, and they can be taught to do those things. And so I
Mhm.
do think it has to be, you have to look at those training specifications. And of course, there should be certain things that are included. Like I mentioned,
Yes.
trauma-informed care, some crisis intervention, maybe even some motivational interviewing, a few different things, bringing in a few different CBT techniques. But at the same time, I do think the pool for those that are available to do this type of work may be smaller if we make all of the qualifications as high as a clinician. We'll be right back after a word from our sponsor.
Whether you're a longtime or first-time listener to Behavioral Health Today, you're probably familiar with Triad, the company that brings you this podcast. But you may not know that Triad also hosts a community for current and aspiring behavioral and mental health professionals, featuring trending content and education and career resources, all for free. If you are a behavioral or mental health professional, or you're studying to become one, join more than 80,000 people on Triad by claiming your free professional account today. Visit us at hellotriad.com/BHT. That's hellotriad.com/BHT and join the Triad community today.
Yes, absolutely. Absolutely. Yeah. Some of the dangers that we've sort of seen is that when teletherapy
Mhm.
boomed after COVID, it was happening before COVID, but I think after COVID, we started to loosen some of the restrictions. We saw
Mhm.
maybe folks who weren't as qualified to
Yeah.
step in as some of those professional experts. I kind of think about reevaluating the definition of what a peer specialist is, right?
Mm.
Because at the end, a peer specialist shouldn't have to do the role of the clinician or the
Agreed.
therapist,
Yeah.
right? So being able to really kind of understand those roles can better qualify folks to do this kind of work.
Agreed.
And then again, you talked about some really good points about additional training that can assist folks. I also think cultural responsive interventions can be
Mhm.
critical, right? Again, I'm thinking about the public health lens, right? When we meet folks in community, I think we can be sensitive to some of that, and that can be very effective in being able to deliver some of that work. Um,
Absolutely. Yeah. And you mentioned before about doing things like workshops and
right.
things like that. I think that is going to naturally require a different skill set that does not necessarily equal a bachelor's degree or a master's degree or a license, even. Like folks can listen and learn from someone who's been through something and experienced it and learn the ropes from them without it being coming from that same level as a clinician would come from.
Absolutely. Right. And also just a different level of engagement as well, right? A
Absolutely.
workshop,
Yeah.
it's something you can pop in, you show up for a couple weeks, and then, by the end of it, you've got some skills and you can walk away with it. But it's not as
Right.
critical as saying you have to meet with this person. They're going to show up every
Yeah.
week and
Yeah.
yada, yada, yada. There's other ways that we can sort of deliver that care that can be very digestible and can kind of meet folks and help them.
Agree. Yeah.
So next thing I want to talk about is sort of the impacts and barriers, right? Because we've seen some changes in the United States, right? We've seen the Trump administration, their new budget eliminates grants that fund recovery programs. I mean, talking specifically about the Detroit Recovery Program, right? They're looking at about $2 million worth of cuts from SAMHSA. It could look like the result of 50% of their staff being laid off. It's a big population, a vulnerable population, again, a community that is still recovering from the crack epidemic. And just to use your state alone, Sharlee, in North Carolina, you've got 6,000 peer specialists serving your state.
Wow.
So it just creates a lot of risk for additional terminations
Mhm.
of peer specialists. Other areas of the program, I talk about SAMHSA or the Substance Abuse and Mental Health Services Administration. Those grants are being cut. State grants are being cut. Pandemic era grants are being eliminated as of last spring.
Yeah.
So, and even just to focus on graduated students that are entering the workforce, student loan forgiveness programs for public service workers have been redacted.
Yeah.
So all those things really kind of affect the influx of people being able to get service, even just changes within the Medicaid that might remove millions from coverage. These are things
Mhm.
that really affect folks being able to get access, as well as an influx of new workers, a new workforce that can assist and address some of the crises. So I want to ask you, what do these funding challenges reveal about our own society and
Mm.
maybe our societal values? And what
Yeah.
risks do you think we face with these programs that are weakened or lost?
I- So I feel incredibly close to these types of budget cuts because I've worked within this public service sector for almost 2 decades at this point. And while thankfully I have not personally experienced the budget cuts, I have seen my students and their families previously, and patients and clients that I'm currently working with, the impact. It's already happening now with with their mental health. People are so much more anxious these days because they're concerned about, well, what will happen with my Medicare payments, or will I no longer be allowed to get Medicaid to cover the cost of my dialysis equipment, or coming in for treatments 3 times a week. And so I'm already starting to see the effects of these budget cuts, and it is a very scary place to be, just as someone who works within the public service sector. So I will say that the risks are huge, and so not just for one set of folks, not just for people who may have mental health concerns now, ones that are developing them, or people that do have substance use or abuse disorders. I am nervous for what those things will look like for them.
Right.
But on the other side of that, I'm wondering if, because peer recovery specialists, they tend to be jobs that don't require a higher level of education, maybe they are offering more jobs for folks like that. So maybe that those positions begin to swell because they can't afford to pay for, a licensed, therapist to come into those positions. And so maybe resources are different, and we have to evolve to meet them. And so it is incredibly scary. I will not lie, but I'm hoping that maybe some positive will come out of this, and there is more of a space for folks who were not able to get into these types of fields before. Maybe it will create a space for them now.
No, I love the hope that you're painting there, right?
Yeah.
Because it does offer, again, challenges. There's an opportunity, right?
Yeah.
It does offer an opportunity for someone else to step into that and provide a service. And it could often be, the peer specialist that, might be more affordable is not the right word, but it might be an opportunity for them to step in, right? Doesn't necessarily have to go through the same kind of red tape as having a license,
Right.
et cetera. Might just be a little bit easier for folks to be able to engage with that type of service easier. But at the
Right.
same time, I don't want these positions to be undervalued.
Sure.
Currently this is an underpaid industry. Low wages contribute to instability. Cut rate prices undermine professional standards. Again, it can be a slippery slope, right?
It is.
And
It
even
is.
just
Yeah.
widening up to the bigger messages that we're sort of sending as a nation,
Yeah.
it sort of claims that these services are inefficient, which is not
Right.
true. And it claims that, these smaller programs won't have a national impact, which is not true. We can see that these things have an impact in our communities, and it can be very beneficial for not just the people that they serve, but the community as a whole.
Absolutely. I think during COVID, it became this mental health is so important. Let's have more therapists here. Let's take care of the people. And it almost feels like society is backtracking on that a bit. Just a few years later, we're not that far removed from the pandemic. And so it is a bit saddening to see that the societal view, or the apparent societal view, has been changed. But also, I'm not super sure that society is fully aware of the impact that is really happening. I know this because I am within this space. I work within it every day. I pay attention to the news in that area because it does affect me, work-wise. So I need to know what's happening. I need to be able to explain, but I don't know that an everyday person knows what is happening
Yep.
if it doesn't directly
Yeah.
affect them. Yeah.
Yeah, it kind of feels like with some of these big sweeps of change, people are experiencing some of these things firsthand and not really
Yeah.
understanding what it was before.
Right. Right. Which is
Right.
unfortunate.
It is.
Yeah,
Yes,
it's
it is.
unfortunate.
Sometimes we have to learn the hard way, but it's unfortunate that we have to learn the hard way.
Right,
for
right.
us
It
to
is
learn
it's
the
a double-edged
lesson.
sword. You need to learn
Yes.
it, but nobody wants to learn it this way.
Yes, but I love the landscape you're painting of how can we learn from this and where is there hope, right?
Right.
Yeah. So as I mentioned before, it does offer an opportunity for empowerment and systemic change. And we talk about how peer specialists navigating these gaps of societal systems. They engage with very vulnerable populations who have experience with healthcare systems and criminal justice systems, and maybe not the best experience as well. But through relationship, peer specialists are able to help folks navigate through complex systems. They help provide support and hope. They can be a huge connection point for advocacy, right?
Right.
Being
Yeah.
able to tell those stories and being able to help those voices get louder as we sort of talk with our politicians, develop different policies. So I know that peer support is not just about individual recovery. It's about reducing stigma. It's about advocating for communities. It's about reshaping systems, right? So I want to ask you, how do you see peer workers influencing the future of mental health and addiction recovery systems in the United States?
And I think some of this is what we've discussed before, maybe
Right.
switching that role from an individualized approach or someone that you need to see, meet with on a clinical or semi-clinical basis, but maybe making it more of a public health outlook to it. Maybe it becomes more, instead of an individual type of thing, maybe it becomes more of community, and let's work
Yeah.
on reshaping the community's needs. Let's
Right.
address each community's needs as needed instead of it being an individual basis. And then potentially even integrating it more with clinical care in some ways.
Yes.
And so bringing in more of those peer support folks into those
Right.
clinical arenas. And so then it becomes a different funding source, right? A lot
Yes.
of the Medicaid and Medicare cuts aren't necessarily to clinical care. A lot of
Right.
them are to these, to some of the smaller types of programs. And so if we can find ways to connect them, and right now I'm not thinking of the name of the program that brings
SAMHSA.
in, SAMHSA, that can bring in those programs directly into and more of an integrated approach. It might look
Yeah.
differently than what we have seen before. So again, just kind of
Right.
reshaping the landscape and allowing our minds to look at things a bit differently. And so
Yes.
while it is unfortunate that things are happening, I do think it creates an opportunity for expansion in many ways that had not been addressed before.
Yes, yes. I want to echo exactly what you're saying. You're talking about a shift toward more personalized support. You're talking about better integration with clinical care and
Absolutely.
even just expansion, right? I can see, look, we're addressing people maybe that are in crisis, but
Mhm.
expanding this into prevention and
Absolutely.
health promotion services. I'm thinking of education services as
Mhm.
well. Like that
Yep.
can be a huge opportunity for us to kind of shift the conversation from addressing the crisis to maybe promoting prevention.
Absolutely.
Yes.
Proaction versus reaction.
Exactly.
Yeah.
Exactly. And I also see it as an opportunity to maybe like develop specialized certification for other populations.
Hmm.
I'm thinking of our conversation with Mallory Tenori, who was talking about her experiences with eating disorders
Mhm.
and how even then is like a little misunderstood. So maybe
Right.
even just specialists within that area can help address that disorder better.
Absolutely. Absolutely. And again, just trying to evolve the situation. And while
Yes.
it isn't where we want it to be, at the same time, it gives us an opportunity to reshape how things look. And I
Exactly.
think that is absolutely necessary to continue to focus on the hope of it. And while it isn't fun, while you're going through it, how can we become better as a result?
Yes, absolutely. Absolutely. So, again, as we think of peer recovery specialists, they do more than support. They empower communities, they reduce stigma, they help people navigate complex systems. Their lived experience creates trust, and their work fills gaps traditional clinical care can't always reach. Yet the fields face real challenges, funding cuts. We talked about uneven training and low wages, threatening the stability of the programs, just as the need for recovery support continues to grow, as you've addressed. Protecting and strengthening this workforce isn't just a policy issue, it's a public health priority. At its core, peer recovery works to remind us that recovery is about connection, resilience, and hope. It's about showing people that change is possible and that no one has to navigate it alone. That's the kind of impact that's worth supporting and celebrating. So thank you very much for joining us for today's episode of BHT Bytes, and we'll see you next time on Behavioral Health Today. We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.